I hope the fan noise doesn't bother you all that much. It's 85 degrees in the house. It's 87 outside, so I had the fan on high, but if I put it on high, then you're never going to hear me. So today, I ended up having a doctor's appointment. I seem to have a lot of doctor's appointments, but it's really not as many as it seems to be. In this case, I went to see my sleep doctor. Although I didn't see the sleep doctor, I saw one of the representatives, the nurse assistant, if you will. And it's a strange thing because I almost decided to shut this one down and say, no, let's cancel this. I'm not coming. The reason I did that is because I've been going to see this office, this guy, for goodness, let's see, since 2006. So that's 17 years. And for the most part, I haven't really gotten all that much information. It's like I go in there, he comes in, he says some stuff, we have a conversation about just general things, not my health or anything like that. He gets the stethoscope out, he does the little test here, and then we set up another appointment. And that's usually it. So I was expecting that today, and I show up at the office, and I'm told that I'll be seeing the nurse assistant. Like, cool. And I hadn't really thought much about it, but I had heard someone call her doctor because I got a call earlier in the morning asking me about a place called, well, I'm not even going to say the name of the place. I'm going to say I haven't talked to those people in years. Are they still around? I didn't even know they were still around. No one sent me there. And so, I'm sitting there. I only had to wait about 5 minutes. They take me into the back. They weigh me. I hate being weighed outside of the house, but that's life. Anyway, I do that. I go into the room. I answer some questions with, I don't even know what they call the folks who ask you some early questions, but whoever that was, she answered some early questions. She took my blood pressure, 120/71. I thought, yeah, that's pretty good. I walk a lot, doing well. So then she leaves. And in about 3 minutes, the nurse assistant comes in. And I can already tell this is going to be much different than any other appointments I've ever had. I had remembered to bring this SD card out of my CPAP machine. I got a ResMed 9 S9, and I remembered to take that in there. And so she had all these papers, and I had never seen my regular sleep doctor ever come in with any papers. So she looked at all this data, and we just started having this conversation, and she asked me how I'd been sleeping, and I told her how I'd been sleeping better because I started taking vitamin D3 as opposed to just vitamin D. I had pretty much stopped it because I was taking these little, those clear, hard little pearl pills. I can't swallow those, so I just stopped taking vitamin D all over the place. And then I wasn't sleeping all that well, did some research, vitamin D3, which a friend of mine had actually mentioned. I didn't even know there was a vitamin D3. So I've been taking that, and for the most part, I sleep better. I have some nights where I still don't sleep, but in general, I've been sleeping a lot better. And it turns out that the papers that she had told her how I'd been sleeping over a 3-month period. She said, yes, you've improved really drastically from where you were the last time. Well, the last time was a year and a half. But she actually had a 6-month thing, so she could see, and she's showing me how bad I had been sleeping, and then how well I'd been sleeping in the last 2 months, 2.5 months or so. I said, it's because of these pills, and I also said it's because I decided to change masks. And she said, why did you change masks? I said, well, I was having trouble with the other one. It's the style I've been pretty much wearing for, pretty close to 10 years. But it just has too much leakage. Even if I fall asleep, it's always waking me up during the night. And the main reason I wore it is because, I was going to bed. I had trouble falling asleep immediately. So I could, put that on and then play Sudoku on my tablet. Or, watch a couple of videos here and there. And with my new mask, I can't do that. I can't put my glasses on. Even if I take my glasses off, I have to close one eye because this is the mask. And as you can see, it covers up. I mean, I have to look out of one eye. So I said, I went to this one because it's quieter and it helps me to sleep longer. I actually breathe better in it. And it turns out that she knew a lot of data based on that little card that the regular doctor has never said. in all these years. And so we had this good conversation about everything. And I'm thinking, wow, how is she not the doctor? Because she just knew all this great stuff. And we had this great conversation. We discussed medications, and we discussed, the sleep patterns, blankets, do I stay warm at night? Because she knew that I had trouble with my feet. My other regular doctor has never mentioned that. Sometimes, you know what, they promote the wrong people. I'm not going to beat up on him because, okay, he was an officer in the Air Force, and, my dad was in the Air Force, so I'm kind of sympathetic to that kind of thing. But still, he's a nice guy, but she was just wonderful. And it's another one of those kind of things that seems to be building on what's going on with me and physicians and the physicians' helpers these days, because I'm talking more to these folks. I'm getting more back from them. I think I did the video, it was like 2 videos ago, where I was talking about going to my diabetes appointment, where it was the nurse assistant rather than the doctor or the PA, physician's assistant. And how I got information from her that I had never gotten from the other physicians in almost 20 years. It's just one of those kind of things where when you're listening, or you have someone who's engaging with you, who has data and information about you, it helps to be able to listen to them, to learn from them. As a matter of fact, she even said, yes, I bet you've lost weight over this. I said, well, yes, thank you. Because the machine is saying I'm sleeping better, I'm breathing better. And she asked me, are you staying awake now during the day? I said, yes, actually, I was still having trouble with that, but I stopped eating the soft bagels in the morning because I drink tea every day, every morning, and I was eating these bagels, and it was just, driving me, to want to go to bed around 11:30. She says, yeah, they have that tendency to do that, so I'm glad you found something else. I said, yeah, toast doesn't seem to do that. So I don't know if it's all bagels or just soft bagels, but I gave that up. So I'm sleeping better, and she noticed it. And then she says, well, how old is your machine? I said, well, it's at least, 10 or 11 years old. She says, they don't usually last that long. I said, well, I treat it right. And then she talked about this other place. Wanted to know if I wanted to upgrade to other machine. I said, truthfully, I like this machine. It does well. I treat it well. I clean the machine. I clean all my equipment. We're fine. If something happens to that, then we'll go and think about this other machine, because it's, it's like $1,100. I'm not necessarily in the mood to pay $1,100 for a new machine right now. But I just thought, how fascinating. It waits until I get into my early 60s, where all of a sudden I keep running into physicians who are actually giving me some pretty good information. I'm still a little upset that the guy I saw last year couldn't figure out why I had this pain in my leg, and I had to go through all these tests, and then me looking it up online gave me a solution that helped to cure some of that. Nobody's perfect. So I'm doing this one because, once again, I want to encourage people that if you have a problem, to go see somebody. Or if you've already got appointments, listen, ask questions. Even if you think it's a dumb question, go ahead and ask that question. Get that information. And, we'll see how this goes. Anyway, that's who I am. My name is Mitch Mitchell. I'm shutting this off now so I can get this fan back on and see if I can cool down this room. Y'all take care.